back.
Welcome you to the first of a series of 3 webinars entitled The Global Fund and the COVID Era, jointly organized by the Friends of the Global Fund Network. This first webinar is organized by Friends US, while the following ones will be organized by Friends Europe and Friends Japan in January and February next year, respectively. As many of you may know, the Global Fund has demonstrated great responsiveness and adaptability early on from the onset of the COVID-19 pandemic. As of the end of November, thanks to the support from its donors, led by the US, it has allocated about $4.1 billion to recipient partner countries. Its investments have focused on mitigating the impact of COVID-19 on HIV, TB, and malaria, but also meeting critical needs in terms of PPE, diagnostics, oxygen, and other critical supplies, making it the largest funder of non-vaccine related COVID-19 support to low and middle income countries that partner with the Global Fund. As in the context of the fight against HIV, TB, and malaria, civil society has demonstrated great resilience since the start of the COVID-19 pandemic. Civil society actors play a critical role, not only to respond to the COVID-19 pandemic, but also to mitigate its impact on the fight against the 3 diseases, which has suffered important setbacks as outlined in the Global Fund's latest result report. Today's discussion will be moderated by Olivia Ngo, who's the Executive Director of Impact Santé Afrique based in Cameroon, and will feature civil society leaders from Ghana, Malawi, and Cambodia, who can all speak firsthand to the Global Fund's impact on HIV, TB, malaria, its COVID-19 response, and how it engages with civil society partners. Olivia, over to you. Thank you.
Yes, thank you very much. Thank you. It's an honor to be here, and we thanks Friends of the Global Fund for their invitation, and also for including civil society in those important conversations. So as you know, COVID-19 has impacted definitely the 3 diseases, malaria, TB, and HIV. And we are very proud to have our speakers today who will introduce themselves, and we will talk about how COVID has impacted their work around the 3 diseases, and also what civil society, what role they have played to mitigate the impact of COVID-19 on malaria, TB, and HIV. And we will hear from them their experience in this particular year. So I would like to hand the floor first to Cecilia. Cecilia to start, and then we will continue with our other speaker. Thank you.
Thank you, Olivia. Hello, good afternoon to you all. Happy to be part of this. My name is Cecilia Thenu. I work with Hope for Future Generations, a community-based NGO, a member and focal person for CS4Me in Ghana. I'm also a member of the Developing NGO delegation to the Global Fund. I am very happy to be here. Thank you. Olivia, over to you.
Yes, thank you. And we have also Grace. Grace from Malawi. Grace?
Yeah, thank you very much, Cecilia. My name is Grace Nguluwe from Malawi. I'm working with you, Healthy Connect 360 in Malawi, and I'm also the Global Fund Her Voice Youth Ambassador, and I also represent young people in the Global Fund Youth Council. Thank you.
Thank you. And now we'll go to Asia, where we have Mr. Sok from Cambodia.
Thank you so much, Olivier, and good morning, good afternoon, and good evening to everyone. It's my great pleasure and honor to be part of this discussion. My name is Chub Sok Chumran. You can call me Chumran. I'm working for Khmer HIV/AIDS NGO Alliance Khana in Cambodia. I am the executive director of this local NGO, and we work on HIV, TB, malaria, sexual reproductive health, and other non-communicable diseases. I'm also the co-chair of the ACT-AP for Asia and the Pacific, and also the NGO delegation, developing NGO delegation to Stop TB Partnership, and the CCM member for Cambodia. Lovely to be here. Thank you.
Yes, thank you very much. So thank you for your time. You know, it's a very busy time, but you all are doing amazing work in your country. So thank you for what you do. I know you probably don't hear that every day, but you are supporting communities, families, children, women, people, and helping them to access health services. So thank you very much for your work on the ground. So I will start with the first question. We were all taken by surprise with the COVID pandemic when it hit us in 2020. And so how does the COVID has affected your work, and especially the fight against the diseases, malaria, TB, and HIV? And also, similarly, what was the role of civil society? What role civil society played to mitigate that impact on the three diseases and to ensure that we continue to advance the fight? So, Sok, we can start with you.
Thank you very much once again, Olivier. Actually, we know that the COVID-19 impact everyone, right? Every country. And for our case, it impacts us not to be able to provide services to the community on the ground, and especially during the hard hit of the COVID-19, especially in this year, 2021, although we got the first case reported of COVID-19 in last year. However, the most hard hit is this year in April, where some of the area locked down and the travel of the staff, of our frontline staff, community health worker, we cannot go to community. We only can communicate by social media, phone contact, to ensure that our client continue to receive services. Especially, we work on TB, we work on HIV, and we work on malaria. So it is very hard. And for TB in particular, in 2020, it slowed down the effort of TB case notified. Every year, the country, we have to expect that we could have the case around 46,000. But unfortunately, in 2020, the case notified is around 19,000. And within this year, within the first 6 months, the country planned to have case notified for TB around 15,000. But unfortunately, because of the COVID, the case notified only around 10,000 only. So you could see it slowed down the effort. It prevents us as civil society to provide services to the people on the ground. However, COVID-19 doesn't stop us. The way that we do is we continue to reach from home to home. For those community that close to our network, we collect, counseling through telephone. We support them to get the medication, to get their supply to their home, and we connect them to our mobile gen expert and X-ray in a small scale, where we can gathering the people to ensure that we can continue to provide them the services. When COVID-19 started, what we can do with support from the COVID-19 rapid response mechanism from the Global Fund, the way that we can do, we straightforward mobilize our community, our partner, our stakeholder to sit together and try to collect information to see what the impact and what we can do, and present the list of the impact to the working group that we work with for HIV, TB, and malaria. And we would like to thank, through the process, it allowed us, especially from this, for TB, we got the support from Stop TB Partnership, to have this kind of fund allocation where we can do this kind of consultation, this kind of rapid assessment. And with the Global Fund Strategic Initiative, we can, call for all key population or representative of key population to come together and discuss and develop the list of priority where we can present to the country, to the writing team, and to ensure that our priority can be included into the application. Thank you.
Thank you very much, Sok. And I was personally very impressed by how civil society were able to mobilize themselves during this pandemic and to actually be able to do all the amazing things that you have listed, but not forgetting that it was during a time of the pandemic where it was limited access in person, there was restriction barrier, there was many limitations and challenges. But despite that, civil society organizations were able to continue to not only, like you said, limit the impact of COVID, but also to support the fight against COVID itself. So it was pretty amazing to do that under those conditions. And thank you very much, Sok. And so Grace, in Malawi, can you tell us how, what was the impact of COVID in Africa, in Malawi, and what role civil society played there? Yes, if you can tell us your point of view. Thank you.
Yeah. Thank you very much. COVID-19 has really brought so many challenges when it comes to adults and girls and young women. And firstly, I'll start with the social welfare of most of the families was really disturbed. Most of the families in Malawi, they rely on pieceworks, in order to feed their families. And they fail to support their adults and girls and young women whenever they need small basic needs. And these girls, usually they contracted themselves into sexual behaviors in order to find their financial support, which led to teenage pregnancies as well as increase in HIV amongst the adults and girls and young women. And it has also increased we have also encountered a high rate of early marriages amongst these adults and girls and young women. Their families were able to support them, and they forced them into an early marriages. That's because maybe a man was able to support the family, and the family felt like their girls and girls can support the family through that kind of a marriage. And yeah, the world has changed into digital, and we literally forgot that not everyone have access to smartphone, have access to data, and yet we still continue giving young people information on internet. And this has really made a lot of young people not to access all the information that we require when it comes to COVID-19, when it comes to HIV, when it comes to access to services. And there was also a bit of misconception when it comes to interpretation of TB signs and COVID-19. Most of the I believe that we lost most of the TB patients due to confusion when it comes to TB and HIV and COVID-19. People were failing to they were failing to go to the health facility to accept a service just because maybe they were coughing, and the sign of COVID was also coughing, which was a very big challenge. Would have saved a lot of lives who were TB suspects, just because we are unable to give them quite enough information in our community. And even young people living with HIV, most of them failed to go to the health facility to access services just because they were forced to put on a face mask. Not everyone was able to afford to buy a face mask just because their financial status was a bit down. Their parents lost their jobs, and everything was very complicated. For the CSOs, I really want to say a very big thank you to the Global Fund and EC partners for coming in to support the COVID-19 response and making sure that there is no interruption of HIV services, and ensuring that the ART drugs are enough. And in Malawi, we haven't run out of stock of ART medication just because funds were there to support the response. And civil society organization helped a lot in spreading out the information of COVID-19 and ensuring that everyone in the rural communities have the information and even the vaccine, the importance of vaccine. We had a lot of cultural misconceptions when it came to COVID-19 vaccine, but the CSOs came in and supported spreading of information in the communities, and even access to safe, youth-friendly, healthy services. The civil society organization really played a very big role in ensuring that young people have these services in their communities through the small youth hubs and provision of the PPEs. Most of the civil society organizations were able to give out PPEs to small youth organizations, small CBOs, just to ensure that everyone in the society, in the community, have access to these services. And most of the civil society organizations also made sure that there was an inclusion of adults and girls and young women in the C19 funding request. I was there, and we had 3 more other young people who were also included. We were able to contribute something towards the program, just to ensure that young people, we are included when it comes to disseminating information and also holding the government accountable whenever we feel like it's out of line of what was written in the funding request. And the civil society organizations also made sure that in their small youth hubs, there were some satellites. Like currently, we have some youth hubs where young people are able to access the ICASA conference and whatever is being discussed, which is also a very good intervention. Despite the COVID challenge and people are unable to go to the ICASA conference, but most of the young people in the rural areas are able to access just because young people have, youth organizations and the CSOs have come together and ensure that young people are participating and are contributing towards the ICASA conference. Yeah, thank you.
Thank you very much. Thank you. Very impressed to see how youth were mobilized and engaged. And thank you for also talking about the Global Fund COVID-19 response mechanism. So speaking of that, Cecilia, we heard from many civil society that we work with that they had a very good experience engaging in the Global Fund C19 response mechanism, and to actually mitigate the risk of malaria, TB, and HIV on the impact of COVID on malaria, TB, and HIV. So Cecilia, can you tell us first about how COVID-19 affected malaria? I know Grace talked about the similar symptoms with COVID and TB, but what about malaria? And knowing that for malaria, some interventions like the distribution of mosquito nets, bringing many people together, were almost impossible to do if we have to respect social distanciation barrier. So, so Cecilia, can you tell us a little bit about that, and also about the C19 RM process, the experience of civil society in that process? Thank you.
Thank you very much, Olivia. I perfectly agree. In fact, without the intervention of Global Fund and its partners, we wouldn't know what would have happened to us in Ghana. And the engagement of civil society has been very great, very, very effective in Ghana. And I want to share that proudly and to thank all of you, especially civil society in malaria, and support from CS for me, with the support in engaging civil society in malaria in the fund request development. Everybody agree, and we all agree that it's a deniable fact that COVID-19 has really disrupted our gains and the gains made through Global Fund partnerships in all countries, including Ghana. For the intervention and quick intervention of the Global Fund through the CR19, I wouldn't know what would have happened. And we thank Global Fund again. In Ghana, civil society, with support of its Global Fund PRs, WAPCAS and CHAD has set up a number of CSO committees at different levels to mobilize community members, key population, young people living with HIV, women living with HIV, malaria communities, to make input into the fund request for the CR19 proposal. And I think it's one of the best things we have ever done. because civil society organizations, small community-based organizations at the very hard to reach communities were engaged virtually. And so what we did in Ghana through CCM and the PRs, the CSO PR, was to share data to them. And Global Fund, more than ever, was constantly in touch with the PRs, CCM, civil society organizations, and were able to make input into the proposal development. TB, HIV, malaria networks were effectively involved, and I'm very happy to say that. What happened that I am very proud of, and I had a lot of quotations from people, was that their lives would have been in chaos if they were not to get these interventions. What happened? There were distribution ever more of community treated mosquito nets going to the slums, going to the villages, going to the hard to reach communities by the malaria NGOs. And we thank CS4Me for building our capacity to do this through the partnership. And so we distributed to so many people, especially women with children under 5, pregnant women were all engaged during the COVID time. Even though we were doing that, it was very intensified because disruption of treatment was so great and everybody was saying it. A high level of people were infected with malaria and continuously receiving treatment. But with the intervention and the distribution of the treated mosquito nets, it has reduced the infection of malaria, especially among the vulnerable population, and among young people and people living with HIV, and among TB communities. And that was one of the interventions. Another thing that civil society and the PRs and community members did was to send food to the hard to reach communities during the lockdown. And so through webcasts, that time with the support of Global Fund, thousands of vulnerable population, people living with HIV, malaria affected and infected communities, TB infected communities, vulnerable population, had food package more than 3 weeks. And throughout the lockdown, they were regularly being supplied with this. And I really want to share some of the quotations. For example, some of the community members indicate that they were not able to feed their families because there was no resources. They lost their jobs. And if during the COVID-19, what has saved them was the food package through webcasts that was shared with them. They were able to feed their families for the 3 weeks that we were in lockdown and almost 1 month. What would have happened to these community members? And young people were testifying how they were engaged during the fund request development. And it was very, very important that first time in the history of young people living with HIV, they were involved. Malaria community civil society organizations were engaged with funding support from CS4Me and from IANASO through Global Fund. We were able to engage effectively during this fund, the fund request development and then implementation. As I talk now, civil society have formed different committees, monitoring the distribution, engaging in community behavior change, mobilizing communities for immunization and young people for immunization. And they are also making sure that effective communication disabuse people's mind on myth and misconception on the COVID vaccination so that they will be able to assess vaccination. And malaria communities especially are reaching up to pregnant women, women with children under 5, and other vulnerable population. What would have happened if we were not to have this Global Fund partnership in country? That has given the opportunity to Ghana to develop these mechanisms to support COVID-19 at this difficult time. It would have been worse if we were not to have this Global Fund mechanism and partnerships. And it has shown that Global Fund is a grant, a partnership that we don't need to joke with. It should be something that donors should support, and countries should take the leadership to ensure country ownership and sustain the fund. Thank you.
Mm-hmm. Thank you very much, Cecilia. Thank you very much. And we saw on the ground that because Global Fund and partners in countries have invested for many years in, for example, community health workers for malaria, for TB, for HIV. We saw that during the pandemic of COVID-19, the countries, the Ministry of Health were actually reacted quickly and mobilizing these community health workers already in communities that were far away from health centers, from media, from accessing information about COVID. We saw that they actually quickly trained these community health workers, and the community health workers were responsible from going door to door in those villages to inform the population about COVID-19, because most of them didn't even know what was happening, and also to search for cases, to bring cases to treatment, and they were very instrumental. So we actually, we think that system of engaging communities were not only effective for the 3 diseases, but also during pandemics like this, it was very effective. And I think we all saw really the power and the benefit and the advantage of having those strong community systems in place in a country. So thank you very much for sharing. I will ask you all another question, starting with Sok. So yes, please tell us a little bit more about how the engagement of civil society through the Global Fund mechanism, and also what do you think we can do to improve it? Because it was very, very, very impressive, but how can we improve that civil society engagement in Global Fund mechanism, especially in the context with COVID-19, and where we still have our 3 other epidemics, malaria, TB, and HIV, that are actually still very present in Africa and Asia. So starting with you, what can we do to improve engagement of civil society? And if you have other examples you want to share on how civil society were engaged, particularly now with the Global Fund mechanism in Asia. Thank you.
Thank you once again, Olivia. Actually, like you said, I just want to echo what you said. Impact of COVID can be mitigated when we have a very strong community system and strong human rights intervention. So fully agree. And we need to keep this kind of, momentum to happen. But it is very important, to ensure this thing can happen. We also need to make sure how community can continue to actively engage in the process before it contribute to produce the output. So in the process, what we did here in our case in Cambodia, we sang for a great opportunity, and especially the leadership of our government, especially Ministry of Health, the CCM, with support from the Global Fund to allow us, and especially with the support from other partners, including Stop TB Partnership for TB in particular, and the Global Fund strategic initiative for the 3 diseases, which allow us to be together to discuss, share information of how the situation happened on the ground, and how can we support the country to propose the priority which responding to the reality on the ground in the application. So this kind of engagement through different process, including, because of the hard hit of COVID, we cannot meet in person. So most of the case, we only conduct a meeting virtually. We join the country dialogue virtually. We provide the report of assessment, of rapid assessment that we did on the ground, from sharing the perspective of civil society, the priority that civil society and affected community want to share with the country to be included into the funding request application. So I think this kind of the process, and the C19 the Global Fund have, it also expand our partnership, not just within the 3 disease program, but it allow us to expand collaboration, get to know other stakeholders within the health system, For example, some departments we have never worked before, in addition to HIV, TB, and malaria. CDC, for example, National Center for Health Promotion, Department of Hospital Management, all of that. We do not experience, we have never had experience working with this kind of department, of these people. But because of the C19R process, it allows us to build a new partnership and connection with them. And, we try to, engage, we try to share, and we request, because each, the way that the C19R process supported by Global Fund for funding request application, it go through by pillar. So we work, we engage in different pillars that are relevant to us. And we need to expand our partnership with those departments that are in charge of the pillar for responding to COVID-19. For example, we engage in pillar 2, talking about risk communication and community engagement, to make sure how can we support, how can we, put our activity concerning to community-led campaign on COVID-19. And at the same time, we are doing the 3 diseases. In this pillar, we also try to propose our priority around community-led monitoring, community feedback mechanism, both for COVID-19, but also for the impact of COVID-19 on the 3 program. In addition to that, we also work very closely with the person in charge of pillar 6 and pillar 7 to ensure our community, our frontline healthcare worker receive PPE support where we can continue to do things. But at the same time, we also receive the vaccination so that we can have a more safe to continue perform our job. And we also, within pillar 7 and 6, we engage in providing IPC education through different channels of communication to make sure our key population, our marginalized population on the ground, they are safe and they are able to access the COVID-19 services, including vaccination, for example. We engage in pillar 9, where we support presenting all the priority for the 3 diseases, from HIV, TB, and malaria to the focal point and to the writing team to put all priority. So this is how we engage. So thanks once again for all this great opportunity where we can expand our partnership through the process. Thank you.
Thank you very much, very much. Thank you so for sharing that. And it sounds like you have so much more to share, and that experience was and is still very, very, very impactful for communities that we serve. So thank you very much for sharing that experience from Cambridge. So now we'll go back to Cecilia or Grace. Maybe can you tell us, yes, what can we improve? What recommendations you have on how we can engage more even civil society in the response to COVID-19? So Grace, if you want to tell us your recommendation.
Thank you very much. I think I will begin with saying that let us include, and we need an active engagement of adults and girls and young women, and especially the youth, as actual partners, not just as mere beneficiaries of activities, because I believe that we are there to amplify voices, we are there to promote services, we are there to make sure that we support the government and other healthy partners in sensitization of different information. And we as young people, we ensure that we support with youth tailored activities that young people can easily adapt with. And we also need a research on what works and what doesn't work for COVID-19, just to make sure that we go to actual interventions that CSOs, youth organizations can easily get into, and be sure that we support the Global Fund in funding, support the Global Fund replenishment next year, which will come in and support HIV, TB, malaria programs. And we can also include the COVID-19 in it, because currently we have encountered the reduction of HIV, TB, malaria funding so that we can cover up the COVID-19 response. So we really need to make sure that everyone, including the civil society organization, are actively engaged, not just as mere partners and mere beneficiaries, but also as partners. We want them to be partners. We want them to be included in all decision-making processes. Yeah, thank you.
Yes, thank you so much. Thank you, Grace. It's actually very great to see how passionate you are about this work. Thank you. So Cecilia, tell us, what can we improve? What would you recommend to improve engagement of communities in civil society? Knowing, like we say, nothing for us without us. So tell us, thank you.
Okay, so thank you very much, Olivia. Global Fund Partnership has always put communities and civil society at the center of grant implementation and even development. This partnership was shown through the C19 RM in Ghana, and I'm very proud to be associated with this. I think what Global Fund has been doing, they should continue doing it. One, strengthening the platforms, giving them the voices. Grace spoke about young people. We must start looking at the various civil society constituencies and strengthen them. I'll give an example of CS for Me, who has given the platform to over 1,000 small community-based organizations to contribute to this. And we are so grateful for that. It's not only in Ghana, but all over. And then the same with Stop TB Partnership. Stop TB Partnership has also played the same role in the area of TB. And so it is important that we start looking at the platforms that give civil society the opportunity to play their role, their unique role, and then communities to raise their voices. I think it's very important. I will give an example of CS for Me. I will give an example of the Stop TB Partnership, the facility, the civil society, the TB Challenge Facility for Civil Society, and also IANASO, GFAN. All these platforms are very important platforms that Global Fund has been using, and they are in the various countries. And so it always brings civil society voice to the table and gives the opportunity for civil society to contribute. I would suggest that these platforms are strengthened in order to prepare for anything that will happen in future. I'm also happy with the strategy they use by giving that flexibility to civil society PRs and even government. They were able to engage a lot of civil society organizations, provide that direction, and many of them took the lead in implementing the community level interventions. It is very, very innovative. And so you will see civil society voice at the table from the beginning of the fund request development to the implementation, and very unique interventions like community-led monitoring, other M&E strategies were involved. I believe that if we strengthen these platforms, these interventions, we'll be able to prepare adequately for future eventualities or anything that will happen to us. Community systems are very important. Health systems are key, but civil society during the COVID-19 period have been given the opportunity, the voice, the resources to reach out to the areas that we have most vulnerable people. And it is going on now in Ghana. As I talk today, civil society is all over the country, monitoring the implementation of the Global Fund under the COVID-19. And I'm very happy that this is going on, and they are coming out with evidence of what the fund is being used for. These innovations are very important, and I believe that the intervention and what has happened during this period should be replicated, it should be strengthened. The civil society platform should be strengthened well-resourced to be able to stand any future eventualities so that we'll be prepared. Our capacities have been built, and we are still building our capacities virtually. Even though we are not able to meet face-to-face, every day we have webinars. CS4Me is organizing webinars. Different Africa, we are now so very Stop TB partnership. And I think these are very important that we should support. The coordination, linkages to other areas is very important so that communities, civil society will continue playing their key role in holding and monitoring implementation in their countries. Thank you.
Thank you very much. Thank you, Cecilia. Thank you for your recommendation. And again, thank you for all the work that you are all doing on the ground to make sure that communities have access to services and also key and right information, not only about malaria, TB, and HIV, and now also about COVID-19. So thank you, and we thank the Global Fund partner for supporting and mobilizing funding quickly for that C19RN mechanism. I think that was very useful in helping to protect the life of communities on the ground. So thank you. Do we have any questions from our participants? Because we also like you to contribute. If you have any questions for any of our panelists, please, you can write them in the chat. Or if you have also comments to make, we'll be happy to take your comments or your questions. So we have one question from Rebecca. Rebecca Vonder is asking what have been the most effective strategies to facilitate good dialogue between civil society and local country government? Very good question, Rebecca. So Cecilia, we can start with you because you are one of the vice chair of CCM in Global Fund. So you are also close with the government in Ghana. So tell us about some strategy to facilitate that dialogue between civil society and local government.
Yes, thank you very much. And I think this is a very good question. It's very, very good. You know, the CCMs in countries are very powerful because they are resourced, they are supported to play that key role, the country ownership, and global fund policies are clear and has empowered civil society and country coordinating mechanisms. During the C19RM, CCM played that role. Because on the CCM, we have government, we have communities, we have civil society, we have the private sector, we have the academia. And this was so clear during the COVID-19 time, and it's still being played. And I believe that every constituency is represented on the CCM. And so that was how civil society, including young people living with HIV, TB communities, women, and all other people have been engaged. And I think that strategy should continue. Because when we were not able to meet face-to-face, there were opportunities and strategies developed by the CCM to ensure that we were engaged. And they were sending data to people who couldn't afford it, including young people. And I believe that the CCMs, if they are strengthened and they continue playing that key role in country, we will continue making it and get everybody inclusion of the most vulnerable people who have been left out over the years. We have also added the gender component because as they engage, they ensure that women, men, boys, and girls were all engaged. And I'm very happy to say that Hope for Future Generation, through IANASO, through CS4Me, has been able to engage the various groups, and that was what we inputted into the fund request preparation with all other PR and SRs in Ghana. And so I think CCM is the best way to go. Thank you.
Mm-hmm. Thank you, Cecilia. So it sounds like CCM engagement is a good strategy and it's a strong mechanism because it's a place where government and civil society sit together and make decisions together about malaria, TB, and HIV, and also COVID-19. So thank you for sharing that. So do you have any strategy you can share? And can you maybe tell us too about how the CCM mechanism, was that an effective strategy in Asia to engage, to facilitate the dialogue between government and civil society, or any other strategy that you would like to share?
Once again, thanks a lot. I think this is really, really important question. It is very important, I would echo Celia, that if the country can adopt the mechanism that in place and supported by the Global Fund to have a CCM in the longer run, where, people from different angles of society sit together and discuss priority, work together, strengthen the partnership. I think that's quite important. So one is about that. How can we ensure this kind of mechanism, this kind of platform continue to exist? Second thing is about the mechanism and the support to be provided to civil society and to affected community to fully understand, the importance of engagement. Because when we say about engagement is easy, right? But when it comes to reality, these people need to be support, in terms of knowledge of how it should work, how to engage, how to advocate, how to closely build up this kind of partnership, benefit of the community at large. So very important, for example, in like Cecilia mentioned, the mechanism for TB in particular that have a challenge facility for civil society that managed by the Stop TB. I think if this kind of strategy, continue to have with enough funding, sufficient funding that can support them to expand, I think that's very important, in particular for TB, very important. So we want to see more funding to be supported for TB. And this kind of mechanism can support a TB affected community to be stronger, to be able to mobilize and support each other to engage. And the other part of a strategy, I'm thinking that, most of the case, the support of community is more around supporting service delivery. But I think there is a limitation for supporting community in terms of institutionalized organizational capacity around advocacy. I think we're very limit donor to support this kind of institutional and organizational capacity, where they continue to play an equal partner in discussion. So it would be lovely to have this kind of thing. I'm not talking about the Global Fund as the only fund that can do that, but the Global Fund can, maybe a Global Fund or the from the beginning support that, but we would love to see more donor to engage, and how can this kind of innovative approach can be adopted by other donor, by the government in particular, or the domestic funding, if possible. So then the civil society, affected community can be equal partner, to have the role to play. Thank you.
Thank you very much. Thank you very much, so for sharing that. So we know that the Global Fund has such a unique mechanism that we call CCM, which is Country Coordinating Mechanism. It sounds just like a word, but I want to make sure that everyone understands that it's a place where, for the first time, you have key population in country that actually criminalize key population, where they are able to sit down at the same table as the Ministry of Health, the Ministry of representative of Ministry of Finance, parliamentarians and others, to discuss how we can advance, for example, the HIV and AIDS strategy and fight. So it's really a unique place where communities which otherwise would not have the opportunity to even be able to talk about this issue or be engaged in the fight against this issue will be present. So it's probably the same thing as youth. So Grace, can you tell us, about that strategy as a unique mechanism to engage youth in malaria, TB, or HIV, and also the fight against COVID-19. And that unique mechanism is what the Global Fund has. And we know many civil society today are able to discuss with their leaders at the same table, having the same voice, the same power, actually. And it's pretty amazing. So Grace, what is your experience as a youth engaged in district disease with the CCM?
Thank you very much. It's really a very good, the CCM is really a very good platform for civil society organizations to contribute towards the 3 diseases, including COVID-19. When COVID came in, it was firstly regarded as a government response, but through the CCM and the C19, the government realized that the civil society organization had a very big role to play in order to support the communities to fight against COVID-19 and even to support in disseminating information. And CCM has always been there to carry out the voices of civil society organizations. We are not always there, but if we have a representative there and we contribute what we want through our representative, we are always encouraged that our voices are always addressed at the CCM table, and the government is able to recognize the need of including us, including civil society organizations and including young people in their decision-making spaces, as well as in the fight against HIV, TB, and malaria, including COVID-19. Yeah, thank you.
Thank you very much. Thank you very much, Grace. And so we are almost towards the end of our event. It's such a nice conversation to have with you. You are very passionate about this work. And what is your last word? What would you say? What is your message for decision makers, for the leaders of the world, as we're going to step into a new year? We've been to a rough year affected by a new pandemic that we had to learn. We have to quickly adapt and learn and fight it. At the same time, we couldn't forget about malaria, TB, and HIV, because mosquitoes were continuing to bite during COVID-19, and also the HIV pandemics was continuing to be present, and cases of tuberculosis needed also treatment. So what is your message to the leader of the world who are making key decisions that actually impact the health of communities? And also knowing that, also your message to the Global Fund, actually, and it's important to acknowledge the fact that the Global Fund was able to react very rapidly to COVID-19, to set up a mechanism for a response, working with more than 120 countries, but adapting very, very quickly. So what is your message to the leaders, and how has that rapid response of the Global Fund, how has it balanced the speed in funding for COVID-19 requests, but also keeping the voice of civil society very central? Because when we act quickly, it's easy to forget communities and civil society. So tell us your message to the leaders, but also tell us what you think about what the balance was between getting those funding to country quickly, but also ensuring that communities and civil society voices are being heard in all of that. So we want to start with Cecilia. Yes.
Global, you cannot, where would have been communities and civil society without Global Fund and its partners? COVID-19 has really made us value the partnership with Global Fund. And we just want to thank the partners, especially those who resource Global Fund and the country ownership that has really coordinated and continue to support us. We are so grateful. And I think this is the time, as Global Fund prepares for its 7th replenishment, this is the time to show that leadership, to support Global Fund again, to continue the great work that they are doing, putting civil society, putting communities at the center. It is time that we support Global Fund. And I just want to encourage Global Fund to continue supporting civil society and communities and saving lives. 44 million lives and more, and they are still saving it. It is something we should really recognize. I already mentioned that strengthening the various civil society platforms is very important. If we strengthen the platforms, then we are sure of giving voices. If we strengthen the community networks, National Association of Persons Living with HIV, if we strengthen Stop TB Partnership, the Challenge Facility for Civil Society, CS4Me platform, Kianaso, different, all the networks that are supporting us, I think it is already evidence that this support has really helped and strengthened civil society voices, and already civil society voices on the table. There's a lot of respect, a lot of recognition of civil society contribution to the C19 RM and for TB, HIV, malaria. This is the time to continue and prepare for future eventualities. I want to ask civil society, colleagues, civil society and community members to continue implementing the innovative interventions. We should not forget about integrating the cross-cutting issues. Gender issues are very important. Engaging young people is very important. Giving the opportunity to people that mostly need it. Strengthening community systems, strengthening health systems is very key. So thank you very much, and thank you.
Thank you, Cecilia. Thank you very much for speaking all the way from Ghana. Thank you. So it sounds like we have a very good system in place, the Global Fund, the CCM, the principal recipient, the sub-recipient, countries engaged, and that actually did work quickly for COVID-19, and that should be supported because it has shown the result and engagement of community. And frankly, we would not be here speaking with you today if it wasn't true, because Cecilia, Sok, and Grace, we are very strong activists in our countries. When it's not working, we say it, and we say it very loud. So if we are here today, it's because we really believe that it was a very effective mechanism. And so, Sok, can you also, thank you, Cecilia. So, Sok, can you tell us your message to leaders and yes, and going forward, yes.
Thank you so much, Olivia. For our message, we would love to see the platform that invests by the Global Fund, that are supported by the Global Fund since the early day, be adopted, especially the CCM, be adopted by the country, building on what is already there, you know. So this is the platform where everyone, you know, contribute, participate, and a stronger partnership. Because I know that, you know, within the pandemic response, it's quite important that we need to work together. We need to work together. We need to act together. So the model that invests by the Global Fund is really, you know, the best model that can, you know, bring together the pandemic response together, that HIV, TB, and malaria cannot be forgotten. We would love to see our leader to, you know, to address the pandemic, but also invest and have to continue ensuring the work for TB, malaria, and HIV. The plan to end these three diseases have to come to reality. So we would love to have our leader to take this as a high priority together with the response to COVID-19. In addition to that, we would love to once again thank the Global Fund, and we would love the Global Fund to continue supporting the investment to civil society, especially the funding that we know that, you know, in most of the case, TB is a very small proportion in some cases.
Yes.
We would like to increase funding for TB so that we have more TB community be engaged, and the platform that, you know, the best model that invests by and Global Fund supported to the stock to have challenge facility for civil society. I think this should be continued to exist. Thank you.
Thank you so much. Thank you, Sok. And it's very true. Apologies. We are running a little bit over time, so we just need a few more minutes of your time, because after we will welcome Mark for his concluding remark. But exactly, Sok, and you said in this time of COVID-19, the interventions are even more costly. So we need to increase our investment to make sure that we getting back on track in terms of malaria, TB, and HIV, but we also continue to fight COVID. So Grace, tell us your word to the leaders as a youth who experienced this pandemic. So tell us, what is your last word to leaders and decision makers?
Yeah, as a young person, I would like to see a high-level political commitment and leadership towards ending HIV, TB, and malaria. And as a young person living with HIV, I would like to see a world where we increase funding in fight against HIV, because I'm looking forward to HIV cure. I'm looking forward to HIV vaccine. Yes, we have come from afar and we have done so much in order to fight against HIV, TB, and malaria. Let's not lose focus. COVID is here. Let's adapt to it. Let's focus also in 2030, what we have hoped for in 2030. So I'm looking forward to an increase in HIV, TB, malaria funding. And I believe when we come towards the Global Fund next replenishment, our donors, our HIV partners, they will come forward and support this replenishment. Thank you.
Thank you very much. Thank you very much. And leaders and decision makers, I hope they're going to hear the message, because your decisions will actually save lives, literally. And we need their leadership and their commitment to be the game changers that we want to see in the fight against those three diseases in this context of COVID-19, because we need to all come together to unite our force and to make sure that we can fight back those diseases, but also get to our visions, which is to end those epidemics. And because it's very much possible. So thank you for your messages, my dear colleagues from civil society. Thank you for your time today, and thank you for your passion and your services to the communities and to people who we cannot see, but there are millions and hundreds of people that you serve every day. So thank you for what you do. And I would like to also thank all the participants, and I would like to hand the floor to our last speaker, so Mr. Mark, to give us his concluding words from Friends of the Fight. So Mark, over to you, and thank you very much. It was a pleasure to be with you. Thank you.
Thanks a lot, Olivia. I'm Chief Policy Officer with Friends US. I heard several themes, especially the role of country coordinating mechanisms as the standing multi-stakeholder way that the Global Fund operates, with a big voice for civil society, helpful for AIDS, TB, and malaria, but valuable in being ready to respond for pandemics as they arise. I also heard a lot about how the Global Fund acted quickly but accountably and included civil society in forming proposals of what was needed for people in communities and a part in implementing. And I heard through the conversation about those people who were reached as AIDS, TB, and malaria work has been disrupted by COVID. Those who are hungry, those whose schools have been closed, youth, especially women and girls, and key populations stigmatized, and community health workers. I want to close by thanking Olivia and Cecilia and Grace and Chanrun, wonderful insights. Thanks to Amina, Ria Florence of the Fund for the Global Fund. The Fund for the Global Fund and Amina coordinate the work of the Friends Network. I very much want to thank our co-hosts, Friends Japan and Friends Europe, and thank my teammates with Friends US. As a network, these three organizations work together to get donor countries to share the moral imperative and financial burden of ending pandemics, longstanding pandemics, current pandemics, and the ones inevitably to come. Thank you all who joined this dialogue, and we will be having 2 more events on this area, Voices of Civil Society on Global Fund's partnership, in February and March, co-hosted by Friends Japan, Friends Europe, and Friends US. Goodbye.